Hi, I'm Shahani.
Hi, I'm Emily.
So first, before we get started, I'm going to need some of your information, okay? So can I get your first and last name?
Emily Wasserman. It's Emilie Wassermann.
Okay, and your birthday?
January 16th, 2000.
And your address?
16098 Riverside.
The city that you live in?
Livonia.
And then Michigan, right?
Yeah.
Your zip code?
48154.
And what's the reason that you came in today?
Just my annual checkup.
Okay. Is there anything else you were worried about, or just your checkup?
No, just the checkup.
Okay. Do you take any medications or vitamins or supplements or anything like that?
No.
Okay. Do you have any allergies to either food or medication?
No.
Do you have just a couple things just to see if you have any personal medical problems?
Mm-hmm.
Heartburn?
No.
Alcoholism?
No.
Allergies?
No.
Seasonal?
Well, yes, seasonal.
Okay. Anxiety?
No.
Asthma?
No.
Atrial fibrillation?
No.
Cancer?
No.
Do you have any bleeding problems? Do you not clot well or anything like that? Any do you have diabetes?
No.
How about heart disease?
No.
And or hypertension?
No.
Okay. Is there anything else that I didn't mention?
No.
Have you ever had any surgeries, wisdom teeth or anything like that?
I have not.
Okay. Do any of your family members have a problem with alcoholism?
No.
High cholesterol?
Mm-mm.
Cancer?
No.
High blood pressure?
No.
Heart disease?
No.
Diabetes?
My mom and my grandpa have diabetes.
Okay. Is that your dad's dad or your mom's dad?
My dad's.
Okay. Okay. Almost done here. Do you use any tobacco or cigarettes or anything like
No.
that? No? Okay. Do you drink?
No.
Do you use recreational drugs?
No.
Okay. Do you have caffeine?
No.
Okay. How often do you work out?
I would say 3 to 4 times a week, maybe for an hour and a half each day.
Okay. Do you have a pretty healthy diet or?
Yeah, I would say so.
Okay. And then that's it. That's all I have for you.
Alright.
Okay. So now I'm gonna do your temperature and check your pulse. Okay.
Okay.
I'm gonna start by taking your temperature.
Okay.
Have you had anything to eat, drink, or smoke in the last 15 minutes?
No, I haven't.
Okay. Okay, I'm gonna put this under your tongue.
Okay.
And we're gonna keep it in for a minute.
Okay.
Okay, are you ready?
Okay.
And your temperature is 98.8. Okay, so now I'm gonna take your pulse, okay?
Okay.
Can I see your wrist? So could you take your shoes off before you get up on the scale? We're gonna start with your height, so can you face that wall when you get up here? Okay, you can step down. Okay, now can you step up again and you can just face the wall? Okay, we are all good. Okay, so everything with your appointment went well, but since you were saying that you had a family history of diabetes, I just wanted to give this to you. So it's just a little like bit of information on diabetes, like prevention and things.
Okay.
Just because especially since you have it on both sides of the family, it's really important for you to be aware of it and try and stay ahead.
Okay.
So like you see like prevention stuff is just the main thing in all of this about like preventing type 2 diabetes and treating it and everything is to try and keep your weight low,
Okay.
exercise 4 to 5 times a week at a pretty moderate level for at least 30 minutes, and then have a healthy diet, leafy green vegetables, like those types of things.
Okay.
Keep your sugars low, keep your carbs low, and you'll be perfectly fine.
Okay.
But if for some reason something were to happen and you ended up like getting type 2 or like being pre-diabetic, we could put you on some medications.
Okay.
Like an example is metformin. We could put you on that, and that would like really slow down the progression of you getting from pre-diabetes to type 2 diabetes.
Okay.
So, and other things you can do is just stop smoking. I know you're not smoking, but like for you it would be don't start, and then limit your alcohol levels. So it's like you can drink, but just keep it in moderation. And then frequent visits with me, just to make sure everything's looking good. Because again, since you have it on both sides of the family, that makes you at even a higher risk. And then keep your blood pressure under control. And there's some risk factors, but you're not really in the group for any of them, so you are in the clear for right now, but just keep an eye out. Like if you were to become overweight or anything, just make sure you're working out and trying to keep your weight low, because that'll really help you out. And staying physically active. And then another thing is you'll start to see in like your armpits and like your elbows and stuff, the crease of your elbows, you'll get like a shiny, like leathery looking or velvety looking skin. So that's a sign that it's like you're starting to become pre-diabetic. And then again, just keep your blood pressure low, daily exercise, good, getting good leafy green vegetables, and keeping healthy diet. Obviously you can go eat out every once in a while, but don't go crazy. And yeah, like if down the line your weight became a problem, just losing 5 to 7% of your body weight decreases your chances of getting diabetes by almost 60%. So it's really important for you to be like proactive in keeping a healthy lifestyle. And I'll look forward to seeing you at our next appointment.
All right. Thank you.